technology is advancing through leaps and bounds to treat the needs of the United States. It's really remarkable, the technology, the kind of things that technology has given us. Angioplasty as a procedure has evolved enormously in the roughly 30 years it's been done now. The biggest change has been stents. Stents solved the Achilles heel of angioplasty, which was the restenosis or reblockage of the heart arteries. You'd balloon it, 6 months later it would come back, you'd balloon it again, it would come back, and eventually you need surgery. Stents originally lessened that chance to about 80% success, which is pretty good. Drug-eluting stents, the next generation, is now almost 99% successful long-term for the majority of people. That's occurred in a very short period of time for science in general because the need is there and the companies have put a lot of effort into doing it. Angioplasty has made things so that people can come in the hospital, have severe three-vessel disease before they only could have surgery. Basically, they go home the next day, 3 stents, no worse for the wear, go back to their daily life the next day. Well, the technology is part of it, but not the part of it which perhaps matters most. Most people want to understand what's wrong with them and want to feel that there's some hope. Without that hope, people just don't get better. If you don't want to get better, you're just not going to get better no matter what we do. So the spiritual aspect of it is extremely important to the overall functioning of both the hospital and someone's ability to get better. People have to feel like they're being cared for, not as a number, not as a patient, but as a person. On every level, there's a humanistic approach here at Holy Cross. We have a very, very advanced team of people who provide spiritual comfort to the patients and their families, regardless of what religion they are. That's a testimony to the associate, the nurses, men and women who work at that level, to the care and the expertise that they want to provide the community of South Florida. Holy Cross is run as a nonprofit institution with a mission, and that mission has come from the Sisters of Mercy, and basically that mission is mercy. Mercy and compassion for people that are ill, whether or not they can afford to pay for it, whether or not they have insurance. It's to care for people as individuals. All we do all day long is touch people. We touch them in ways which are important to their healing, and that human touch is what gets people better.